there ain't no stopping us.
Hey guys, what's up? Jeff here again to orient your fitness in the right direction. Great coffee. So today I'm going to be talking to you guys about getting a trapped nerve in your back from a slipped disc. And to better understand this better, we're going to have to go into the anatomy of the spine a little bit. So your spine, it has these vertebral bones. So you got vertebral bone, bone, bone. And right behind these vertebral bones, you got your spinal cord traveling down. And out of the spinal cord, you have nerves that branch out. And between each of these vertebral bones, you got a intervertebral disc. So disc, disc, disc. And here's the makeup of the disc pretty much. You got an inner gooey layer called the Nucleus Pulposus, and you got a harder outer layer called the Annulus Fibrosus, which is pretty much the layer you immediately see on each of those discs. And when that outer layer begins to crack, that inner layer can then begin to bulge out or herniate outwards. And that is pretty much a slipped disc, what it is. It's either a disc bulge or a disc herniation. So if those cracks form, then that inner gooey layer can bulge out or come out completely, which is a herniation. And that can then compress on nerves that come out of your spinal cord. So in a way, it can trap them. And then that can lead to those nerve symptoms that travel all the way where that nerve is distributing in your body. So if that nerve is coming all the way down into your leg, that can lead to those nerve symptoms that include pain, tingling, numbness, and burning. Those sensations that can happen all the way down your nerve, which isn't very pleasant. It can also be known as sciatica. So if that is happening to you, you'll likely want to see a doctor. Perhaps they can give you something to reduce your pain. You might want to see a physical therapist. They can give you some exercises, something like the Mackenzie exercises, to try to push that material back into place where it's supposed to be in the disc. Usually these things take about 2 to 3 months to resolve, maybe longer in some people, but you'll want to see someone because the pain is likely to be pretty great. But perhaps the best thing you can do is prevention. Just prevent this from happening in the first place. And a major thing that causes these cracks or the damage to occur in the disc over time is people, they slouch in their chair a lot for extended periods of time. So this can be just sitting at your computer, sitting in your car, just sitting at work, sitting on the train. Maybe some people, I see them, they fall asleep on the train. And that's pretty bad because not only does slouching in your chair place greater pressure on the discs in your lower back, but if you fall asleep on the train, those vibrations occurring over and over again, that can then begin to add extra pressure on your discs and lead to them cracking more over time. So the big thing you want to do is have good posture while you're sitting down. Be aware of your posture. Perhaps even have some kind of alarm clock going off every half hour or hour, reminding you to go into a better posture if you're slouching in your chair. It's not going to kill you to slouch every now and then, but if you do that for every day, for extended periods of time, it's going to eventually add up. So you want to be in good posture. You want to sit up in your chair. So essentially, don't do this. Don't slouch in your chair. Be in good posture and sit upright like this. Alright guys, hopefully you found that video informative. This has been Jeff once more, orienting your fitness in the right direction. If you liked that video, please thumb it up, comment on the video, and subscribe to my channel. And until next time, I will see you guys later. Great.